7:45 on your rainy Monday morning. Morning sickness, pregnancy, stretch marks, there's an app for that. Dr. Stu Jones is an OBGYN at Riverside Hospital. He is one of our regular guests here on Good Day. Thanks for being here.
Oh, you're welcome.
Okay, so brand new for Ohio Health. There is an app. There now is officially an app for everything.
There is.
But there's an app for being pregnant. So
No,
how does it work?
This is one that just coming out now. We're just actually putting it out to our doctors. They have to actually sign up for it so their patients can get it.
Okay.
And it's an Ohio Health app, and you go to that Ohio Health mobile and click on OBGYN, and it'll have all the things about pregnancies you want to know. It's really neat.
That is so interesting.
It'll talk about symptoms that you have at each part of the pregnancy.
Yeah.
It'll talk about how big the baby is, when the baby should be moving around, and you can even put your scheduled appointments with your doctor on there. It puts reminders out to you.
Wow, and
so
that
you
is
don't
what
miss the
every
appointments.
expecting mom needs.
Sometimes they forget things.
Yeah, an appointment reminder. I love it. Let's talk about the second trimester. It's very different, and that's when women really feel the most change, right?
It is. You've gone through that first trimester, and it's
Right.
not the best time for you.
No.
The nausea, fatigue.
Yeah.
And one of the things that first gets better is the nausea. Your appetite starts coming back, and actually sometimes comes back a little quicker than you want.
Yeah.
And I'll see people 20 weeks, and they'll feel like they've gained way too much weight.
Right.
They get worried about it. And I tell them it will settle down. It's just a little surge they have there at the end of that second trimester.
Wow, and some pain too, it looks like.
Well, one of the things we get called about the most is called round ligament pain. At least that's what we call that. And it's a pain down to the sides of the abdomen, the lower portions, and on each side here. And if you go to stand up quickly or get out of bed or roll over, cough and sneeze, it kind of doubles you over at times, and it scares people.
Yeah, that
not dangerous to the pregnancy, but probably one of the things we could call it on the most.
Okay, good to know, good to know. What about when we start feeling that baby move? You know, that first kick, it's an amazing thing to experience. When does that start happening?
Usually, and it's different with the first pregnancy, usually around 20 weeks, sometimes a little bit later, sometimes a little bit earlier. Depends on mom's body, it depends on where the placenta's on the front part of the uterus. But yeah, that's a great thing from when they start feeling that.
What about a baby stethoscope? Do you recommend women getting one of those?
Please don't get that. No,
Okay.
there are ones that are good, and they're similar to the ones we use in the office. They're pretty expensive, $400 or $500.
Oh, wow.
You know, the $20 stethoscope, people get that trying to hear the baby's heartbeat. Now, especially before they feel it start moving. And just don't get that. My sister got one of those with her first pregnancy. I made her take it back because I knew I'd get phone calls every 5 minutes.
Well, you worry, because if you don't hear anything, that doesn't mean that it's just not, it's not working. It's not that the baby's not heart
you have enough things that people worry about when they're pregnant. When you can't find the heartbeat at 20 weeks, you know, it scares them to death.
Oh my gosh, I can imagine. Okay, so you've just finished shooting the One Born Every Minute.
Yes.
How's that going so far?
We're on the second week of shooting for the second season now, and it's going great. I mean, the response from patients and docs, it's twice as big as it was the first time.
Are you still looking for moms to be a part of this?
Oh, sure, yeah. They can talk to their doctor, go to the One Born Casting website. Definitely still looking at moms.
Where's the feeder?
Probably, we had as many people or more within 1 week of opening it to the public than we did over 5 weeks the first time.
Oh, that's fabulous. Congratulations.
Thank you.
We look forward to seeing more of that, and of course you'll be joining us sometime soon in the near future. Once again, Dr. Stu Jones, thanks so much.
Oh, thank you.
All right, over to you, Lisa.